Please welcome Dr. Carroll.
Right now, as of this morning, our hospital is at 101% capacity total. That means we have more patients in the hospital in a bed than we're licensed for by the state. We have an exception, we're not breaking any laws. As of this morning, at a 137% ICU capacity. That means we've expanded our ICU. It's been 30 days since we've been under 100% ICU capacity. We've been a month over 100% capacity. Of the patients that we're seeing in our ICU, we've ranged from about 50% to 60, 65, 66% of those patients that are in the ICU because of COVID, with a significant number of them being on a ventilator. 51.5 is the average age of patients with COVID in the ICU last week in St. George. 56.5 is the average age of patients that are not in the ICU in St. George with COVID. This is very different than what we saw last year. And we're in the situation because over 25% of our hospital is filled with patients that have COVID. Never before have we had one condition account for 25% of patients in the hospital. That's very, very unusual. The red line is the most sobering line, and that's the 7-day rolling average of patients that have died from COVID. And I purposely use the word from COVID because these are not patients dying with COVID that are dying from something else. And I read the chart of every patient in our hospital. I feel personal ownership. Every patient that dies in our hospital with COVID, I read their chart. And these are patients dying because of COVID, not simply having COVID. This is our ICU capacity, and I already mentioned it's been about 30 days since we've had ICU capacity under 100%. This affects other patients. We're turning away patients that hospitals are calling and saying, can we transfer our patient to you? They need an ICU bed and we don't have the capability. You're a trauma center. And for the first time ever in the history of our hospital, we're forced to tell them no. We don't have a bed for you. That doesn't feel good. The data couldn't be more clear that the vaccination is working. The vaccine is preventing people from coming to the hospital. The middle is those in the ICU, and on the far side are those on a ventilator. The COVID vaccination is preventing hospitalization, it's preventing ICU stays, and it's preventing ventilator use and death. It's not perfect, and we can see that. We know there are breakthrough cases, and you may have heard of breakthrough cases, and those will likely continue to occur. But the more people we have vaccinated, the more this number will go down. We have a tool in our tool belt that we can use, and many people, I think I've heard that the overwhelming majority in this room have chosen to use that tool. Thank you. Among physicians in the United States, somewhere between 95 and 98% of physicians have been vaccinated. These are people that have spent their life studying medical research, and I can say with complete confidence, they're not going to do something that they don't feel is right. They've made that decision based on a review of the literature. And if our physicians that have been studying literature for their entire career are vaccinated at a 95 to 98% rate, I think that sends a very strong message to the safety of the vaccine and the effectiveness of the vaccine. We do know that the people that have been vaccinated can still get COVID. We do know that people that have been previously infected with COVID can get COVID a second time, particularly where they were infected with either the wild type or the alpha variant and then be subsequently infected with the delta variant. We know that vaccination decreases the risk of that. We know that prior infection decreases the risk of that. And we know that prior infection and vaccination further decreases the risk of that. So to be clear, I am recommending vaccination. I'm not recommending go and get COVID and then also get vaccinated for double protection. We have had more deaths. In fact, since the beginning of September, we've had between 20 and 25 deaths. The last couple of deaths that I've reviewed have been between 25 and 35 years old. The Delta variant is hitting us in a very different way. I think there's only a few minutes left before we need to end. I do want to try to take as many questions as I can, and I'm happy to stay afterwards to answer some questions as well. Please.
How are your staff holding up?
This is really difficult for our staff, particularly in the ICU. When we staff the hospital, we staff on based on acuity to some degree. So a patient in the ICU needs more nursing care than a patient that's not in the ICU. And I think that makes sense to most people. If you're sick enough to be in the ICU, then you need a nurse taking care of just you, or you and only one other person. Based on staffing and based on expanding our ICU to 140%, we don't have the luxury any longer of having one-on-one nursing care. Often we're going to 1 in 3 nursing care in the ICU, which doesn't feel good to our nurses. They don't feel like often they're able to give the best of themselves to each patient. But if we don't do that, we have patients that don't get a nurse. We've had to move some of our nurses from the medical surgical floors into the ICU to help out, which means we've changed our ratios out of necessity on the floors as well. So that's difficult for our nurses. We're asking them to work additional shifts, and they are. They're stepping up, they're coming to the table, and they are doing truly, truly heroic work. And I love our nurses. This is hard. We have lost some. We continue to lose some that are just feeling so burned out based on the workload and based on the death that they're seeing at a higher rate than they've ever seen before. And so we continue to hire, we continue to train, we continue to take specific steps to support our nurses, but this is hard for them.
Dr. Carroll, you touched on this, but can you maybe drill down on what misinformation is and why it's so damaging right now?
Yes. So I think there's a couple of categories, and I'm sure I'm going to forget a number of them. One that I think still persists is what if you're pregnant, intending to become pregnant, or recently pregnant, breastfeeding? There's been a lot of information on the internet about it's not safe. That's not true. It is safe for people that are pregnant, intending to become pregnant, or recently pregnant. Let me take a step back and say, where did that come from? Because like many things, this started with a kernel of truth and then got legs of its own. The COVID vaccination targets the spike protein, and the spike protein looks similar to a protein called syncytin, which is important for implantation of a fertilized egg. So the question was raised, what if you're creating antibodies against the spike protein, will those antibodies also react to this protein, syncytin, and prevent implantation? So we got some observational, retrospective data, but we also have some very good studies. The one that I think is the most insightful is in vitro fertilization. These are women that are purposely trying to get pregnant, and they know not only the week or the month, but the moment that the egg was implanted. And researchers looked at 3 different categories. Women that had been previously infected with COVID, those that had been previously vaccinated with the COVID vaccine, and those that had neither. There was no difference in implantation rate. If the antibody against the spike protein impacted implantation, we would see that occurring in COVID as well, because those antibodies would be formed not just with the vaccination, but also with COVID infection. We're not seeing that occur in terms of implantation. What we're seeing is that it's far preferable to be vaccinated and be pregnant than to get COVID when pregnant, based on that.